Hello, my name is Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for women who have just delivered a baby. Tip number 1, postpartum vaccines. Make sure that you get all of the vaccines that are recommended for you once you deliver your baby. The measles, mumps, rubella, or MMR vaccine, and the varicella vaccine should be given to you after you deliver if you are not already immune. Ask your doctor about this. The Tdap, or tetanus, diphtheria, acellular pertussis vaccine, should be given to you after you deliver if you did not get it during your pregnancy. The Tdap vaccine is recommended for pregnant women after 20 weeks of pregnancy. And if you didn't get it late in your pregnancy, you should get it once you deliver. You should also ask and get the influenza vaccine, the flu vaccine, if you did not already get it during this flu season. The influenza vaccine should be given all the way until May, as there's still chance of getting influenza by late May, and if a baby gets sick with influenza, it can be very serious. Lastly, the HPV vaccine, human papillomavirus vaccine, should be given to you if you are eligible for it. Ask your doctor for more information. The HPV vaccine prevents cervical cancer and genital warts. Tip number 2, breastfeeding. Breastfeeding has benefits both for you and for your baby. Breastfeeding reduces the risks of stomach infections for your baby, as well as the risks of eczema. Breastfed babies are less likely to be hospitalized. Breastfeeding helps bond with your infant, and it helps you return to your pre-pregnancy weight. Breastfeeding is recommended for at least the first 4 to 6 months of your baby's life. And during the first few weeks, you should breastfeed whenever your baby is hungry. And this is not less than 8 times, and usually between 8 and 12 times a day. If you're planning on returning to work and still would like to breastfeed, ask your healthcare provider about a breast pump, which you can use at work and store your milk to bring home for your baby. If you are breastfeeding, I do recommend that you take a multivitamin, the same prenatal vitamin that you might have been taking during your pregnancy. And if you're having any difficulties with breastfeeding, you should ask your doctor about a referral to a lactation consultant who can help you based on their expertise in breastfeeding. Tip number 3, pain relief. You may feel pain in your uterus from it contracting after delivery. You may also feel pain in your perineal area, which is below your vagina. This is very common and can be best treated with ibuprofen, 600 milligrams every 6 hours as needed. Also, using an ice pack on your perineal area is very helpful after delivery if you're having pain there. Tip number 4, don't smoke. A lot of women quit smoking during pregnancy, and it would be a great opportunity for you to continue not smoking after you deliver. Smoking has serious health risks for you, but also for your baby. Babies who are exposed to cigarette smoke are more likely to get respiratory infections, lung infections, as well as ear infections. So make your baby's delivery a reason for you, just another great reason for you to quit smoking and stay quit. Ask your doctor for more help with smoking cessation if you're having difficulty. And if you do decide to continue smoking, then make sure that you do not smoke in front of your baby and that you change your clothes before holding your baby, or have some sort of a robe that you can put on to prevent your baby from breathing in the clothes that you were wearing when you were smoking. Tip number 5, avoid constipation. When you're constipated and straining after delivery, you can cause more pain in your perineal area. The best way to avoid constipation, not just after pregnancy, but all the time, is to drink plenty of fluids and eat a lot of fiber. You should aim for 30 grams of fiber each day from foods. And foods that are high in fiber include oatmeal, bran cereal, beans, and prunes. I also recommend 3 teaspoons of psyllium powder, or the brand name is Metamucil, to drink with water or juice. This is a great source of fiber, and it also helps lower cholesterol. Tip number 6, postpartum blues. Postpartum blues are very common. It usually lasts 1 to 2 weeks and only means that you'll be your mood will change just a little bit after delivery. If you're feeling depressed or have lost interest in doing things or thinking of hurting yourself, then this is not postpartum blues and this is not normal. This is something that you should bring to your provider immediately. Postpartum depression is also very common after delivery and should be treated. Also, your doctor may consider testing your thyroid if you're feeling depressed, as low thyroid is also very common after delivery and can cause depression. Tip number 7, pelvic muscle exercises. Pelvic muscle exercises, or Kegel exercises, may have a benefit for women who have trouble holding their urine after delivery, or in general who wish to tighten their pelvic floor muscles after delivery. Kegel exercises involve contracting your pelvic floor muscles. For women to know where these muscles are, you can insert your finger into your vagina and squeeze your finger. These are the muscles that you will want to contract during these exercises. During Kegel muscle exercises, another way to know what the muscles are is while urinating, to stop the flow of urine. These are the muscles that you'll want to tighten during the exercises. The way to do these exercises is to squeeze these muscles, to contract them and hold them for 8 seconds and then let them go. Do this 10 times and repeat this so that you're doing it 3 times a day, every day, for at least 4 months. If you have any questions, you should ask your doctor for more information on how to perform them correctly. Tip number 8, contraception. Contraception is recommended both for breastfeeding and for non-breastfeeding moms. For breastfeeding moms, it's recommended that you wait until 6 weeks after your baby's born to start contraception. And the most recommended contraception are progestin only. So the progestin only pill, or the Depo-Provera shot, or the Mirena IUD are recommended for women who are breastfeeding. Women who are not breastfeeding can have more options in terms of combined oral contraception, which is estrogen and progesterone. Combined oral contraception is recommended instead of just single progesterone only for women who are not breastfeeding. And it's recommended that you wait at least 3 weeks after delivery to start taking combined oral contraception, as there is an increased risk of blood clots if you start taking combined oral contraceptive sooner. Tip number 9, a postpartum visit. Make sure that you visit your doctor, your obstetrician or your family practice doctor or your midwife 4 to 6 weeks after delivery if you delivered vaginally, and 1 to 2 weeks if you delivered by cesarean section. This is a good opportunity to bring up any questions you have with your doctor, and for your doctor to do a catch up on your history and examine you and perform any necessary blood tests. Tip number 10, believe in yourself. Having a baby is a great experience, and I hope these tips have been helpful. Thank you very much for listening, and have a great day.